In 2019, the Health Ministry experienced several milestones, mostly positive, but also challenges that left some shaken. One of the big achievements was the ministry's stout vigilance against the Ebola outbreak in the Democratic Republic of Congo. The viral hemorrhagic fever claimed thousands in the Congo, but the Ugandan government prevented the infection getting into Uganda. Health Minister Dr. Jane Ruth Acheng says the ministry is now focusing on new and lasting interventions in health promotion.
We do believe that when we streamline communication and we streamline the community aspect of education and community health extension workers, we will go a long way in addressing some of these preventable diseases, including those that are associated with poor hygiene and sanitation, including those that require, prevention like malaria, HIV, and TB. And the good news is that we now see a downward trend of all these communicable diseases, but it needs more effort for us to completely get rid of them.
Ministry of Health undertook this massive immunization, and I think this is one of the largest such undertakings in this area. And potentially this is one thing which will shut down measles and rubella and continue the suppression of polio.
However, Dr. Idro says there was some progress and challenges in the preventive measures to stop the productivity of the population.
Right now, over 70% of our surgical budgets across the country is being used up for injuries resulting from road traffic accidents, particularly border injuries. When you think about it, it is causing one of the highest number of deaths of young people who are really able to work and produce, economically active part of our population. Two, it's not just the death, the number of people who are suffering long-term disabilities, amputation of limbs, somebody's hands being cut off because of a severe injury. Those who suffer severe head injuries and brain injuries, and they are maimed forever.
He says there is need to adequately find solutions to sustain resources for our healthcare system.
From human resource and in terms of money, to adequately provide for the supplies which we need. So we chronically, in almost all the health units, we are chronically missing, lacking the tools to use, even for people who fall sick and reach our health units. And then on the other hand, the human resource human resource challenges are really massive.
However, the ministry continued to battle with improving its staffing challenges, especially of health workers, despite the still conservative salary structure review policy. But here is the burden the ministry has to deal with. The Health Sector Development Plan of 2015-16 to 2019-2020 shows that the number of health workers per 1,000 people in Uganda is still far below the World Health Organization threshold of at least one doctor per 1,000 people. Amongst the central-level institutions, Uganda Virus Research Institute, Uganda Cancer Institute, and Uganda Heart Institute are the least staffed, with levels of 38%, 67% and 57% respectively. At the local government level, health center 2s and general hospitals remain severely understaffed at 52% and 68% respectively. Staffing in the regional referral hospitals has also fallen from 79% in 2014-15 to 69% in 2015-16. The regional referral hospitals with the most severe shortage are Moroto at 40%, Soroti 56% and Hoima at 59%. One of the main reasons for the decline is the retirement of health workers not backed by timely replacement.
Many of our interns are receiving inadequate supervision because the senior level supervision, the senior consultants and the medical officer special grades are not there in these units. And this brings up the next challenge. It is starting to affect the quality of services which we are offering.
What is going on is that we are recruiting on a replacement basis, meaning if there is a gap, we fill it up, where people have left the facility or they've gone out for greener pastures or we have lost them, we recruit and we replace. Now, what that means is that we cannot be able to achieve 100% recruitment of human resources for every facility. But even then, the other challenge we have is that this structure that we are recruiting human resources on was revised nearly 10 years ago. The population has grown, the needs have changed over the years, and many other cadres of specialities have come up and have been trained in this country. So what the Minister for Public Service is doing now is looking at ways of having the structures revised.
The ministry also continued to suffer budget shortfalls, with Uganda still not meeting 15% of the annual budget to the health sector as provided for in the Abuja Declaration more than a decade on. And it is yet to suffer more setbacks as government is finalizing a move to further downsize its budget. Walter Mwesije, NTV.